Internet, Donna here. I am excited. I am getting very close to having 1,400 subscribers, and after 1,400 subscribers comes 1,500, and I have decided that at 1,500 subscribers, I'm going to do a giveaway. Now, the people at Denture Fit were kind enough to provide me with a freebie to give away to one lucky, randomly drawn fine folk, and so and this is a complete Denture Fit kit, including the 2 tubes of silicone, a bottle of primer, 2 primer swabs, and an instruction booklet. So this will be coming your way once I hit 1,500 subscribers, if your name is drawn. And I will tell you at the end of the video how to enter once we hit the number. No, I won't tell you at the end of the video. Once we hit the number, I'll tell you how to enter. So it'll be in a future video. I am super thankful for OTC Dental to provide this for us so that we can do a fun giveaway. I love, love, love when that happens. So let's go ahead and jump right into today's topic. I wanted to talk to you all today about dental phobia. Dental fear, dental anxiety, dental phobia is something that plagues a lot of people. Now, a certain amount of fear is normal whenever you're going to see the dentist or any doctor for that matter. But if your anxiety affects your oral health and prevents you from going to the dentist, then you may be experiencing dental fear, dental anxiety, dental phobia, you know, whichever label you want to give it. According to ChirurgicFamilyDentistry.com, current estimates reveal that 5 to 8% of Americans avoid dentists out of fear. Straight up fear. Meanwhile, 20% are anxious to the point that they'll only seek dental treatment when necessary. Only when absolutely necessary. I'm talking abscess, broken tooth, loose tooth, lost tooth, like tooth got knocked out. Like, there are some people that will only go to the dentist in cases like that. Now, I remember being deathly afraid of the dentist when I was a little kid. I'm not so bad now, but nothing bad happened to me. I just remember hearing stories about how bad braces hurt and how, hi honey, and how, look at that ass. Oh, he sat on it. And how, you know, the smell when the dentist is drilling your tooth. So I got super, super anxious, and my grandparents didn't really know that you were supposed to take little kids to the dentist. So I didn't visit a dentist until I was 12 or 13 years old. And that's bad. After going for the first time, though, and seeing what the exam was about and what's up with a cleaning and what's up with actually getting your tooth drilled and, you know, if it really makes the smoke and all the stuff that I was hearing at school, it wasn't that bad. Now, mind you, I had weekly visits with the dentist every single week after that for, I want to say, 10 weeks maybe, because I had so many cavities and things like that. And so, and I learned proper care of my teeth and that kind of thing. I ended up losing them later in life anyway, but I wasn't afraid to go to the dentist anymore, and I'm not now. But a lot of people are. Dental anxiety is usually triggered by certain events or experiences. Some of those could be loss of control. Some patients feel like they're losing control when they lie down on a dental chair or lie down on the table at the doctor for that matter, and find it overwhelming when the dentist is hovering above their teeth and probing inside of their face. Okay, they typically associate that feeling with helplessness or being trapped. And I'm sorry if this is, I'll go ahead and say trigger warning now. I should have said it in the first place. If you're a person that suffers from dental phobia and this is one of your triggers, I apologize. There are 1, 2, 3 more coming. So maybe skip ahead a little bit and see if you can't avoid it if this is you. Another thing that can trigger dental anxiety, fear, or phobia is pain. Most people dread going to the dentist out of fear of pain, especially those who have a low pain threshold. Thankfully for me, I have a pretty high tolerance for pain. So even when they do the stabby in your gums with the numbing medication, that little sting, well, that big sting that accompanies that, it's not so bad for me, but I've heard others describe it as excruciating. And if you're one of those folks, I'm so sorry. I can't imagine what that must be like for you. Embarrassment. Some patients feel ashamed, and this was me. This was me, and this is why I put off getting my teeth taken care of and yanked and pulled, whatever, for so many years. Embarrassment. Some patients feel ashamed or embarrassed when dentists look inside their mouth and examine their teeth and gums. Discomfort can also result from the little distance between a patient and dentist during treatment. But for me, I was completely embarrassed for a dentist to look inside of my mouth and see all the gross that used to be in there. And I had one dentist chide me so bad about how I had not taken care of my teeth. And he was right, because, you know, when it hurts to brush them, then you don't brush. And when you're embarrassed about your teeth, you don't go and see the dentist. So by the time I went to see that dentist, you know, I was good and embarrassed to even be there in the first place, and he made me feel like ass. So I just didn't go back for 6 years, 7 years, something like that. Past experiences also can be a trigger for dental phobia. Most people develop dental fears due to a bad experience in the past. So if a previous treatment was painful, had complications, a patient might develop trepidations about going to the dentist again. Also, some dentists aren't real good with little kids, and if you happen to be a little kid that happened to have a dentist that wasn't good with little kids, I'm so sorry that happened to you. That's awful, and I want to assure you that not all dentists are like that, and going to the dentist now, you're not going to be treated that way. And if you are, I mean, you're a grown-ass woman or man, and you can punch him in the face. I don't recommend that, but you can. So, I've been using these three terms interchangeably: dental anxiety, fear, phobia. There's a difference. They're similar in a sense that they all have something to do with apprehensions about visiting the dentist and getting treatment. My dog just flopped on the floor and distracted me. But they differ a little bit. Dental anxiety refers to being uneasy or worried about something unknown. And it's anxiety about the unknown. Most patients will experience this to a certain degree, especially if they're about to undergo a treatment for the first time. So your first extraction, your first filling, your first root canal, your first cleaning, all of these things, fear of the unknown, that'll cause you some dental anxiety. Meanwhile, fear is a reaction to known danger. So that can be brought about by a bad experience in the past. So if you had an extraction before that you weren't all the way numb for, and you have to go for another extraction, that's not dental anxiety, that's dental fear, because you know that there could be a problem and you know exactly what that problem feels like. Dental phobia, on the other hand, is more of an intense feeling of fear or dread. People who have it are typically panic-stricken, will do anything to avoid dental visits and treatments. Okay? Typically, dental phobics only visit dentists and seek treatment when it's absolutely necessary, when their condition becomes overwhelming, when you're up all night for 3 nights straight crying because you can't get a break from the migraine that your toothache has caused. Okay, that's a phobic right there. A dental phobic is gonna deal with all of that and then finally go to the dentist. Dental anxiety, fear, and phobia not only lead to poor oral health, but they also affect a person's well-being. In fact, they can pave the way for other health problems like low self-esteem or self-doubt. So here are some ways that you can maybe try to overcome some of your dental fears. Okay. Number 1, recognize your fears. To better understand your feelings, address them. You need to come into terms with your anxiety or fear of going to the dentist. So listing your fears, write them down, you know, so that you can talk about them better. List them, and that will not only help you to recognize them, but also to help your dentist in explaining what's causing your anxiety or phobia and helping you deal with it. Number 2, and I really, now that I'm looking at this, I really should have put this at number 1, find the right dentist. A big part of overcoming your dental fears is choosing the right dental center to work with. Look up local listings, ask family and friends for recommendations, read reviews, do all of that research, and find a good dentist. Focus your search on dentists who specialize in treating anxious or fearful patients. And there are dentists out there that do that. Like, that's their specialty. So once you narrow down your choices, call each of them. Pay attention to how the staff talks to you. Are they accommodating? Did they sound dismissive? Did the dentist return your call if he wasn't able to come to the phone in the first place? If you're comfortable talking with them on the phone, you're more likely to be comfortable with them in person, and it's probably a good fit for you. When you go to your visit, take note of the place's atmosphere and surrounding. If it's clean, you feel relaxed, and that's a good sign it's a clinic that can address not just your oral problems, but also your anxiety. Number 3, you can communicate your fears and anxiety. Not only just listing them for yourself, but the foundation of any good relationship is communication. So early on, before you even set up an appointment with the dentist, it's best to be vocal about your apprehension. This way, you're going to give the dentist a way to gauge your situation and to tailor an appropriate treatment plan for you that will not only treat your oral issues, but will treat your anxiety, your fear, your phobia, all in the same shot. And that's exactly the kind of thing that you need. Try to determine ways to gradually reduce your fears. Visits shouldn't just be about getting a procedure done. It should be about creating a good experience. So any fear or anxiety can be reduced for the next time you have to go in. The right doctor isn't going to rush you into treatment if you're uncomfortable. Let me say that again. The right doctor is not going to rush you into treatment if you are uncomfortable. And this is one that I feel merits repeating because for me, I viewed dentists and their ilk as the sort to turn the human mouth into a money mill. And I would have procedures recommended one right after the other, right after the other, right after the other, with basically no break in between. I wouldn't even be done healing from extractions on this side before they wanted to go in and do them on this side. Yeah, let's get you in next week to take care of those. Well, next week I'm still bruised and can barely eat anything, and I'm having trouble talking from having, 2 teeth pulled, and they want to take 2 out on the top on this side now. So I didn't go back to that dentist for that. I looked for another one. As you work with a dentist, see if you could start with milder treatments and work your way up to the big ones. So if you need a cleaning, you need some plaque removed, you need an extraction, and you need a filling. Okay? Have the dentist go in order of the milder thing to the harshest thing. So from, the cleaning all the way up to the extraction in an order that makes sense so that you're building up to the big thing instead of starting with the big, huge thing and then working your way down. That's not going to do anything for your anxiety. Another thing that you can do is bring a companion with you to appointments. Bring a friend, bring your spouse, bring your partner, bring your kids. I mean, don't bring your kids, but bring your kids, okay? Having someone with you can offer an extra layer of support or assurance. And if it's your kids, it can distract you from what's really in front of you. And distraction can be a powerful tool that you can use to your advantage in a situation like this. So, don't bring your kids, but bring your kids, okay? Go with someone who doesn't have any fear about going to the dentist. Schedule an appointment in the morning so you can spend less time dwelling on your fears before you have to go. See if sedatives are appropriate. Sedation can be administered to keep a patient calm and relaxed during treatment. Sometimes that's local anesthetic, sometimes it's nitrous oxide, sometimes it's oral or IV sedation. Discuss with your dentist if sedatives are available, and if so, which one will work best for you. Now, I'm not a big yoga buff or anything, but practice relaxation techniques. The relaxation exercises can help you stay calm during treatment. Okay? One of the ways you can relax is through controlled breathing, which involves taking a deep breath and letting it out very slowly, which will help relax your muscles and slow your heartbeat. And for anybody that's experienced dental anxiety or anxiety of any kind, you know that racing heart is your first indicator, oh my God. And basically you can hear it in your ears. It's bad. So yeah, breathe. Use distractions. Again, bring your kids. Bring a Sudoku puzzle. Bring an iPod loaded up with some really angry music or soothing music, whatever it is that's going to help you. Fiddle with a stress ball, count to yourself. You can watch a funny video or whatever while you're in the waiting room to help you relax before your appointment. If it's that bad, if it's so bad and you don't feel like any of these things can help you, seek the help of a psychologist. Psychologists specialize in addressing phobias, including dental fear. So if you need a professional to get you ready to go see another professional, like you need that psychologist to get you ready to go see the dentist, take advantage of that, especially if you have insurance that'll cover it. Yeah, buddy, take advantage of that, because not everybody is afforded that luxury. And also reward yourself. Once you overcome your dental fear, or you do particularly well at an appointment, you go and you get the thing done, and you don't chicken out, and you don't flake on them, and you don't call and cancel. Reward yourself. Girl, dude, go get you some Starbucks. I mean, maybe not, because it might hurt if you've just had a filling or whatever. But buy something nice for yourself. Treat yourself, okay? Get, you know, spend $5 on something frivolous. Spend $10 on something frivolous. Spend $100 on something frivolous if you've got it to throw away. I mean, hell, why not? I mean, you just conquered the beast. Like, go you. You totally slay. All in all, keep in mind that dental treatments are way more advanced now than they were when you were a kid, than they were when I was a kid. Because, you know, back when dinosaurs roamed the earth, we had teeth and stones and guys named Ugg with big fingers. Dentistry was not what it is today. Okay, a dental visit is not going to be as dreadful as you think, because its goal is to keep your oral health in check. Its goal isn't to scare you or to make you feel like crap about the condition of your teeth. It's to restore your teeth back to the way that they're supposed to be, and or to keep them clean and healthy if you've been taking good care of them anyway. So what about you? Do you suffer from dental fear or anxiety or phobia? 2 of the 3, all 3? I'd love to hear about that. If you could leave me a comment in the comment section below. I love to read and respond to every single one. And that's all that I have for you for today. Until I come back tomorrow with a fresh new video for you folks, be good to each other, keep smiling, and keep being awesome.